This is Chapter 10, Urinary System. We're going to start. This is CMA on page 94. All right, organs of the urinary system. The urinary system is divided or defined as a group of organs that are responsible for filtering out excess fluid and substances from the bloodstream. Underline that. Just know it's cleaning out your body. We know that as well. The liquid that's formed is called urine. Urine is a liquid that is produced by the kidneys, collected in the bladder, and discharged through the urethra. So it's produced by the kidneys make it. It's collected in the bladder, and we discharge it through our urethra. Urine is also used to withdraw excess vitamins, minerals, and blood cells from the body. So when you got too much of something, it's going to put it right on out through your kidneys. The organs of the urinary system are the kidneys, bladder, ureters, urethra. So you got your kidneys, bladder, ureters, urethra. For your kidneys, of course, we got two of them. Underline that. And they are located at the long axis, is even with the body, but each kidney's upper end is slightly tilted toward the backbone. No, it's tilted toward the backbone. And they all have a helix.
Both of them are tilted?
Mm-hmm. They look the same, both. Both of them are slightly tilted. And that's why, when you're having kidney problems, urinary tract problems, you'll feel that in your back more than you're going to feel it in the front. The helix. All the helices, you know how a bean is shaped? This little bean. That's what a kidney looks like. The helix is that spot right there. Right in the middle. That's a terrible drawing. But that's what it is. Same as you got the helix in the lungs, where all your stuff goes to your lungs, and that same it's just the little section there where everything goes into. The root of it, or how it connects. That is called the helix. It's located in the mixed section of the concave border. That's all they're saying right there. All your renal veins, arteries, nerves, and lymphatic vessels go into there. So does your upper ends of your uterus. So everything's happening right there. That is where everything goes in and coming out. Of course, it's shaped like a bean, and it's about 4 to 5 inches. And it's got different parts. We're not going to so dig into that, but I do need a little bit of it. The cortex is the outer portion of the kidney. Just the outer portion. The medulla, which is the middle, the center of the kidneys. Also know that the nephrons are located in your medulla. Sorry. And they maintain the water-salt balance. Nephrons maintain water-salt balance. Renal pelvis, that's just the upper end of the ureter. And then, of course, you got an artery going in there. Got to be supplied by something. Urinary artery. The ureters, underlined, you've got 2 narrow tubes which channel urine from the kidneys to the bladder. Just the 2 little things coming from your kidneys. They done made the urine, now they're going to the bladder. That's what your ureters are. And then the last sentence there, ureters can become infected causing urinary tract infection. You don't want to get to the kidneys. That's the worst. We got all kind of stuff before we get to the kidneys. That's all still a urinary tract infection. You can walk in with even a kidney infection and they say, oh, you got a urinary tract infection. They don't dig so hard unless it does not heal. They'll give you some antibiotics and send you about your way. But if it gets any worse or you're having different symptoms, it might be your kidney. Otherwise, it's probably just an infection in those areas there. But they'll call all that a urinary tract infection, all the way up to your kidneys. Then you have your urinary bladder. Of course, it temporarily stores urine. Underline that. And you also need to know, and this is your basics from somewhere that you've hopefully worked, that it can hold up to 15 ounces of urine. Underline that. But we need to know how many milliliters that is. So 1 ounce equals 30 milliliters. Write that down. It should be that if you're working CNA or healthcare that you are monitoring people's intake. And what they'll normally say a cup or say a milk carton. I always base everything on a milk carton. Because I grew up with a milk carton. A milk carton is normally 8 ounces. How many milliliters would that be? And most healthcare facilities want you to record in milliliters. So that milk carton is 240 milliliters. And most of your cups is going to be 8 or 6 milliliters. Those little glasses they give them mostly are ounces. So in order to record them, you want to record them in milliliters. So you have to times by 30. Soda bottle, 24 ounce soda, times 30. That'll be how many milliliters is in it. So just know that 1 ounce equals 30 milliliters. But that's how I always thought about it when we're just having to estimate. You'll know where you're working at, how much each container holds. You'll just get that. Sometimes even if you look on, I don't have any cups around me like normal, but a lot of times the ounces will be on the bottom. Let me see this. This is 32 ounces. Now what is 32 times 30? Whatever that is in milliliters.
32 times 30 is
900 plus. 900 plus. You know that. Because 30 times 30 is 900. So that's what you would record. And just know that they're in there. And that's a lot. But most of the time they're going to give them, like for breakfast, lunch, dinner, the same cup. So eventually figure out how much is in that cup, how many ounces, and then you can figure out your milliliters. And sometimes you'll just start knowing the milliliters. But you're going to have to start somewhere. Because especially working in a hospital, they're going to want you to know. You might have to empty a urine. How do you empty a urinary catheter bag? There's a little thing on the bottom. You flip it and pour it into a cylinder, and it'll measure it for you. Sometimes you can measure in milliliters or ounces, but that is one thing you'll have to measure. 1 ounce equals 30 milliliters. So if you have 8 ounces of urine times 30, 240 ounces. So just know that may be part of your job. And this is, I don't know if I've told y'all, and none of y'all are trying to get internships, but Archibald is not hiring anybody who has not had an intern.
Yeah.
So that's half a Thomasville plus.
That's why I asked
So when we go somewhere and have like, what, how many hours you say?
Up to 120.
So if we go somewhere and have 120 hours, we just put that on the resume or something?
Yeah, that you did internship. Yeah. Because they are not hiring. They said, oh no, they need to have some experience. You wanted, the people who certify you want you to have been working in healthcare.
So my CNA works?
So, nope.
But she can add that to
Yes, always put whatever you got on your certification. Everything you got. Everything. But for CMA Archibald, they want you to have an internship.
What's the office again in Carroll?
That's Dr. Bari. Bari. Archibald owns most of the doctors here, little doctors' offices, and the big offices. And all of my people that got internships got hired. That one that would not do an internship because she had a job sitting there messed it up for everybody. She did. And I can see her because she was a negative type person. Always, I can see way she was acting. And I can see, we didn't do that. We didn't learn that. You're not going to learn half of what you need to know to walk in an office and know what you're doing if you do not do your intern. This is book work. You got to learn all the other stuff. And I'll actually send you videos, and it's probably up to 100 videos. Possible things, depending on where you're going to work at, what you're going to be doing. I just want you to look at them and be responsible. Say, I did look at them. Because it's possible that they're going to be showing you the same things. Got your book work, got all that, but these, as far as your skills, we do EKGs all day, but there's a whole lot of other things that are possible depending on where you're going to work at. And they don't want you walking in fresh. They don't want you walking in not knowing your vital signs. how to do a box sign. That's kind of your basics of your CMA. And it should, most of that should come from your healthcare that you've already done. That's how the certification lets you take this 6 hour or 6 week course. Or else you would take the whole course and learn everything. So you got to pull from what you know, what you've learned, what you've seen, what you went into the doctor's office for, and that person walked you through that door. That probably was a CMA. So everything that you've done experienced in life, put it together. But they're not gonna hire people, and she straight up told me that. So that is your key to success. And it's probably, if they feel like that, most of your doctor's office is gonna feel like that. But I'm telling you, all the people that's got their internships got hired. Well, I think I have one, but she's not completely, she hadn't even took her certification yet, so, but she's finished class. But them internships is gonna get you in your door, because they know you've been there, you've seen something, you've done something, and they're not gonna have to spend 100 hours doing on-the-job training, because you're gonna do that, and you're gonna learn the way they do things. But you need to have some kind of basics of what it is that you're about to do. And I'll send you some videos for that, but that's coming where you do clinicals. We're about to be finished with most of your book work, so we'll do some more. We're going to do review, and some clinical stuff. All right, review,
It's a what?
clinical stuff. Urinary bladder. Remember, 1 ounce equals 30 milliliters. Write that down. You may have to record intake, output, and that is part of it. That got me off track, but I just wanted to make sure y'all are getting there. Certification does not require it, but you're gonna have a harder time getting your job. Just leave it alone. Once filled with urine, the so-called stretch receptors send impulses to the spinal cord, which releases it and fills up your bladder, and then it comes on down, and it tells you, okay, now I need to use the restroom. That's all they're saying, that you have 2 sphincters. A sphincter is just the muscular valve at the bladder neck, and then you have another right there at the urethra that you actually sit on the toilet and say, okay, time to pee. But before that, you've got one at your bladder that releases it, and then your body says, okay, now I gotta use the restroom. 2 sphincters. The urethra is the last part of your urinary system. It actually, that's your exit point of urine. In women, it's about 1 to 5 inches long, underline that, and men is 6 to 8. And that's why women are more susceptible to bladder infections. They have such a short urethra that bacteria gets on in there real quick. Like man, not so much. Even if the bacteria was to get in there, it's got a long way to go, but they'll probably flush it on out before it gets time to grow. And that's how why men don't get urinary tract infections as often. Your urethral sphincter. The sphincter are muscles that are used to control urine flow from the bladder. So you've got a urethral sphincter. So it's already come down, and that's another sphincter. You got 2. Just remember that your sphincter is controlled by your muscles and nerves. So your brain's kind of in there too, saying, okay, you got to use the restroom. And your muscles got to work together to make you use the restroom. Nephrons, come on down. We're not going to go digging so hard. Nephrons do a lot of stuff at a lot of different places, because nephrons are very, they do a lot of stuff. What I want you to know are 1, 2, 3, 4, and I'm going to give you those. Number 1, nephrons remove waste from the body. Number 2, manage blood pressure and volume control of electrolytes and metabolites. And number 3, manage the blood pH. So actually you can have 4 there. Nephrons remove waste from the body, manage blood pressure, manage volume control, and manage blood pH. It is a lot going on in your nephrons. They are very, very, very little and very, very functional. They do a lot. And that's another reason why if you have high blood pressure or diabetes and you got them little bitty, they're little. And you got all this trying to happen in those little bitty areas, and you got high blood pressure, which is damaging them because they're messing them up, and blood sugar, which is blocking everything, that what causes damage to your kidneys. And that's why your kidneys go bad really fast, because these nephrons are so small, it messes up. No, come on down. The glomerulus is a capillary tuft located within a Bowmans capsule. And again, we're not digging hard. All this is happening in your kidneys. All this stuff is in your kidneys. The Bowmans capsule is exactly what it is. It is a cover, and it's a capsule for your glomerulus. So what's in the Bowmans capsule?
Capillary
Glomerulus. That's what we're talking about. The glomerulus is located within the Bowmans capsule. So what's in the Bowmans capsule? Your glomerulus. And it does a lot of things, and I want you to come on. It filters waste out of the blood and initiates formation of urine. Underline that. A lot of stuff happening in your kidneys, or else you just get dirty blood, and then if we don't get it clean, we're gonna need some dialysis. Filters waste out of the blood and initiates formation of urine. Come on down, and this all I want to, afferent and efferent arterioles. Afferent meaning away, efferent to arterioles. This means smaller arteries. But what I want you to remember is the last two sentences, both of those little paragraphs. Afferent arterioles play an important part in regulation of blood pressure. So regulation of blood pressure. And efferent maintains glomerular filtration rate. And all that's happening is in your glomerulus, it is filtering out stuff. So that's all the filtration rate is it doing it right? Is it doing it in the rate it should be doing it? Okay? We just think about it as simple terms and don't go digging so hard. Filtering rate. It's filtering. How fast is it filtering? Is it doing good or bad? That's your filtration rate. Bowmans capsule, or they also will call it the glomerular capsule, and underline that first sentence. This capsule, which is cup like sac that surrounds the glomerulus, is made up of visceral and parietal layers. Just visceral and parietal. Visceral, just like all your organs, again, is the saran wrap of that organ. That's what visceral will always be, no matter what organ you're talking about. But all organs, they make you learn that again, but it's the same thing. It's the covering over that organ. And then your parietal is always the second layer. And I always say it's parallel to the other layer. But it's the cushioning. Same thing, you got visceral for your brain, visceral for your lungs, visceral, this everywhere. But that's like, I always call it the saran wrap of the organ. It kind of holds it together, keeps it its shape, keeps it there, and protects it in that sense. And then you have the parietal, which protects it from all the other stuff that's around it. Okay. Don't go digging on that either. But that last sentence in Bowmans capsule, where it says it allows the passage of ions, water, small molecules from the bloodstream into the Bowman space. So that's where all the action is happening in your kidneys. Allows the passage of ions. Ions is that simple plus and minus. All the, especially sodium and potassium. But that's your ions, water, and small molecules from the bloodstream into the Bowman space. Next is your proximal convoluted tubule. In nursing school, we learn all this stuff and we break it down. You're not going to go dig that far. But what I do want you to know that it, come on down, it says responsible for regulating the pH of filtrate. Filtrate is just what's coming out your kidneys. Whatever is filtered, they call it filtrate. It regulates the pH and the exchange of hydrogen ions, bicarbonate ions. Hydrogen ions and bicarbonate ions. And all that is things we need, and it breaks it down really, 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 really good. I mean, it breaks it down to where, you know how, and people normally can get it when I say 6-6, H12O6. It's breaking it completely down to where you got your C's over here, your O's over here, and positive and negatives. And it's completely breaking it down. That's what your kidneys do. And then we use it for energy. We use it for all kind of stuff. We need hydrogen and ions just for energy. All that's happening in your kidneys. They also feed your cells. I mean, it's really, really, really breaking it down. That's your kidneys. Distal convoluted tubule, just know this. It's regulated by hormones. And these are your hormones. And this is also related to your blood pressure medication. And it tells you what kind of medication. If this is wrong, if this is wrong, so this is the medication we're going to give you. And that's what they can figure out. That's why they try different blood pressure meds for different people. They're trying to figure out what's going on, what's wrong in the system. So, come on down to parathyroid hormone. Where it said, I need a 1 beside that sentence. If the parathyroid hormone is present, that's a 1. The next one I want you to put a 2. If aldosterone is present, and atrial neuretic peptide, that's 1, 2, and 3. Those are hormones that are regulating your blood pressure every day. And if you remember back when we learned about blood pressure meds, so go back to them, and they dig on the blood pressure meds. So learn them blood pressure meds, and what is controlling them. So if it's the parathyroid hormone, that's a hormone coming from your thyroid. What it will do, it reabsorbs water and it excretes more phosphate. Just underline it. Parathyroid hormone reabsorbs more water, excretes more phosphate. And this is how your body regulates. Them hormones come out because something's happening. Your blood pressure needs a little this or it needs a little that. And this is how we fix it. They throw a hormone in there. Your brain says, okay, we need a hormone over here. And this is what that hormone is going to do. So your aldosterone, also a hormone, it reabsorbs more sodium and it excretes more potassium. Underline that. And then your atrial, y'all know where the atria is, right? Where's the atrial? Your heart. So atrial natriuretic peptide, that's your heart saying, they got receptors everywhere. We got them in the heart, we got them everywhere. It's saying, your heart says we got to excrete more sodium. So all of that is making your kidneys either whole potassium, whole sodium, excrete more water. It's doing a lot of stuff. I really think the body's amazing, but that's what's happening. And depending on what's going on, where things are happening, that hormone that is secreted out of that area, like the atrial natriuretic peptide, comes out your atrial. But it's telling it to excrete more sodium, so water goes right on out with it. It really depends on what's wrong, or what levels it needs to fix, where it's high at, where it's low at, and it'll tell your kidneys what to do. And that's what your hormones are doing. And that's where they're doing it at the distal convoluted tubule. But all those are telling, let's put out more positives and negatives, and those are what it is. Parathyroid hormone reabsorbs more water, excretes phosphate. Your aldosterone reabsorbs sodium, excretes potassium. Your atrial excretes more sodium. Just remember those. And look back at your blood pressure pills and where they do that in that chapter. I want to say chapter 2. I can't. But it's they're going to dig there when they ask you your certification questions. They're digging a little more there. Functions of the urinary system. Of course, we know it is to eliminate waste, which are the products of metabolism. So when metabolism happens in your body, we produce waste. And it also is called excretion. So we are excreting waste caused by our natural body's metabolism. And metabolism is a wonderful thing. We got to have it metabolized in everything. It's working on everything. That's what metabolism is. It also regulates the amount of water that's excreted. It regulates the concentration of electrolytes. And helps maintain the normal pH. And it has a normal pH, so bacteria won't grow, so it won't be caustic to your body, because it is waste from your body. We don't need it, so it's going to regulate that pH. So So it needs to be regulated. That's why they will check your pH as well. That's why it's important to drink more water. That pH will be fine. Underline what the kidneys' primary function is to maintain homeostasis. So kidneys maintain homeostasis, which is stable internal environment. Homeostasis, we want it wonderfully working. What it does, the kidneys separate mineral salts, toxins, urea, and other waste products from the blood. It's just going over again what we learned a minute ago. And it's just saying it in a whole total different way. We're excreting what we don't need. That's it. Okay. Kidneys also conserve water, salts, and electrolytes. It excretes some things and keeps some things. We need certain amount of sodium, potassium, water, salts. We need some, but we also need to get rid of some. It's all going out in your urine. The 6 important roles of the kidneys. You've got number 1, regulation of plasma ionic competition. What is plasma? That is your blood, part of your blood. So your kidneys are making sure that your blood also has its ions correct. That's all ionic composition means. And that's your pluses and your minuses of all your little stuff when it's really broken down. Sodium is a positive. I can't remember, but it really doesn't matter. It's pluses and negatives that all work together. And those are your ions: potassium, magnesium, sodium, chloride, calcium, bicarbonate, phosphates. And they will do a test, your blood test, and all of that will be listed. Then you got plasma osmolarity. All that is, again, is your positives and negatives. That they're keeping some and letting some out. Number 3, removal of your metabolic waste. We already know that. What are some of your metabolic waste? Number 1, ammonia, uric acid, creatinine. And they'll do a blood test to see if you have enough creatinine happening, being excreted, because that is going to show the function of your kidneys if you don't have the correct amount of creatinine being excreted. So also know that phosphate, that's the number 3. So 1 should be ammonia and uric acid, 2 creatinine, 3 phosphate. Come on down. Know that too much uric acid can cause crystals and give you gout. So what is gout? Too much what in your system? Uric acid. And it should be getting gone in your kidneys, and sometimes it does not happen. And gout can be terrible. It kind of reminds you like diabetics, where sugar gathers up, but these crystals are gathering up in your joints, and it hurts. And a lot of times it'll be in a toe. Sometimes it'll be in joints. Most of the time it'll get stuck there, and you can't move. Secretion of hormones. That's another part of function of your urinary system or your kidneys. They release renin. Underline, they release renin, which leads to the secretion of aldosterone. Aldosterone actually is released from the adrenal cortex. That's your brain in there. Also part of your kidneys. But renin, just know that it is a very important hormone. Regulating blood pressure. Anything renin deals with the kidneys. Aldosterone helps the kidneys to reabsorb sodium ions. So underline that. There's also a pill that helps with that regulation. Okay. Come on down. We're going to actually it's 4 and 1, 2, 3, 4. It's 5 and 6, but it's also formation of urine. The formation of urine happens in 3 steps. You got filtration, reabsorption, and secretion. Filtration, that's exactly what it is. It's filtering. Just put filtering beside it. We got to filter it out first. Just like you want to keep something, we got to filter it. And they're just really going over the same things, just making it bigger words. But all we're doing is filtering. We're filtering. And then next step is reabsorption. We're going to keep some of it. filter it out, then we're gonna keep this, let that go. So we're gonna keep some of it. And that's happening in your tubules. And what are we gonna reabsorb? Number 1 is water, put a 1 there. Number 2 is glucose, put a 2 there. And number 3 is sodium ions. We're gonna reabsorb those. We need those, we don't need them all thrown out. Sometimes they do throw out glucose because you got too much. But 1, 2, and 3. Okay? All that's happening right there in those tubules. They're very important. Itty bitty things are happening, but so much important is happening in the kidneys. And then the last part of your formation of urine, you got filtration, reabsorption, and then after we filter it out, keep some, we got to throw some out. That's your secretion. So, secretion. Ugh. Some of the substances secreted, come on down there. Potassium ions, hydrogen, ammonia, drugs. That's how we can do a urine test and find out, drugs, the metabolites of those drugs. After it breaks down, what does it look like in your urine? And they figured that out, so we can test for drugs. But all that stuff will be coming out. And if anything's wrong, it'll be out of way. Your urine will tell a lot of things about you as well. And from that, if your kidneys are not working, your blood will not be correct. So they can tell a lot just from putting those 2 tests together. They break it down. I don't want you to go digging, but active transport means they're trying to tell you how, from the tubule to your bloodstream, how does it happen? There's a little space in the middle. I always say it's like a membrane, which it is. But how does it happen? Sometimes it actually has to take and something helps it go across. That's called active transport. So somebody had to go in there and pick them up and bring them back over. Active transport. Or passive just means that it goes through. It's the only 2 types of transports of your ions that's happening. Sometimes they have to go over there and bring it over. That's active. And where you're passive, it just flows over. And all that's happening in your kidneys. Kidneys do a lot of stuff that is amazing, that we're not out of whack all the time. Okay? So, get that in your head. Water-salt balance, same thing we've been talking about. Just going to put it in a different perspective. Kidneys are responsible for maintaining water-salt balance of the blood. Underline that. It also maintains blood pressure, blood volume. Your kidneys are awesome. This balance can be changed by simple factors such as dehydration, ingesting water, blood loss, salt ingestion. All that can make your kidneys do different things. So, first thing it's going to do, and again, we're still back on, they're going to mess with those blood pressure meters. Reabsorption of water. There's such thing as called the antidiuretic hormone, ADH. What do you think something that's anti-diuretic going to do? What does a diuretic do? We learned that. Y'all know that it's the last thing on the meds. Lasix is an anti-diuretic. Y'all go back. Yes, flushes the water out. Any diuretic flushes water. Go back. Y'all got to know that. That's going to be one of your easier answers that they're going to ask because it's basic. That is one of your basics. Lasix. And what it does. It helps you excrete water. That is one of your, go back to that the medication chapter. I'm trying to find it now, so don't. We have a basics. Page 2728. 2728. And they told you way in the beginning. Y'all got it. That's why I said don't just study for those questions. It's not gonna work. Y'all not gonna be happy campers. They really, I don't see where they break it down into diuretics, but it goes right with, I don't see where it says diuretic, but,
Diuretics is on page 27.
there it is. Thank you. Thank you. Thank you. anything diuretic is putting water out. How is it putting water out? Thank you.
How does it out from your kidneys?
Yes.
Urine?
No, that wasn't a question.
Oh,
But yes, it always by the kidneys. But a diuretic is, there's different kinds of diuretics, and that causes different things. But your main one is gonna be that Lasix. They're not gonna let that go. So put that with that. And page, I was trying to get back to that page. Page is 11 and 12. Those are your categories of medications. And then they break it down. These are your blood pressure meds. And they're gonna ask you, what does it do? How does it affect the vessels? How does it affect the muscle? Does it affect the nerve? Go back in those. And I remember telling y'all gonna have to get back in there. It don't go away. And that's why those 10 questions does not help you on your certification. You got to study your chapters. That's where I want y'all at. Don't be so worried about the 10 questions. Well, everything. And then when I ask you 10 questions, you'll get that too. But they dig on those there. Okay. It reabsorbs water by using the antidiuretic hormone. So what does an antidiuretic do? If a diuretic puts out water, what would an antidiuretic? Reabsorbs water. So reabsorb water with an antidiuretic. That is the heading there. Reabsorbs water. Antidiuretic. So of course it's going to control the water excretion. So we're going to hold on to it instead. We don't have that ADH. Some people will excrete too much water, and it really depends. Some people hold it in. So you got to doctors will figure that out. But a lot of times that is happening from receptors from your aorta or your carotid arteries. Them arteries send out signals telling the kidneys what to do. Hey, we got too much going on over here, or I don't have enough blood going on over here. I need you to hold on to some water so we can have some blood volume. And that's what's going on, and it's happening all in your blood vessels. They got little receptors that say, hey, we need some more over here, we need less over here, and that's in your body. Or it's going to reabsorb salt. What hormone is it going to use to reabsorb salt? Your aldosterone. Come on down. ADH is your antidiuretic. It holds on to water. What holds on to salt is your aldosterone. Underline aldosterone. It's getting a little complicated where you got to learn something. Some of this other stuff y'all just been remembering. That's okay. You're gonna have to dig a little bit and learn and get that stuck in your head. So we reabsorb water with antidiuretics. You're reabsorbing your salt with aldosterone, and then it maintains or increases blood pressure, blood volume as well. They're doing the same things, and that's the last sentence there, last little end of that sentence. They're doing the same things in different ways. And then you got your atrial neuroretic hormone. We've talked about this. Where is that hormone coming from? That signal is coming from your heart saying, hey, I need something over here. And it's when the cardiac cells are stretched due to a higher blood volume. So it's going to tell it to hold back and excrete more sodium. So along with sodium goes water anyway. So atrial natriuretic hormone. NATR. What does NA stand for in chemical wise? Sodium. So that's what it's telling you. The atrial, that NA is giving you that clue. It's got to do with sodium. It promotes the excretion of sodium, which causes blood pressure to decrease. It's coming from your heart. It's just a signal from your heart. We got signals everywhere. This one's coming from your heart. And they call it the ANH, which promotes excretion of sodium. Get those right in your head. Then we have hypernatremia. This is an actual condition that probably should have been over here. But that's That's all right. Is that what's next on y'all's hypernatremia? Okay. That's exactly what it is. That clue again, Na. What does Na stand for? Sodium. So it's high sodium. What is emia? Always. Anemia.
Conditional.
In your blood. Something in your blood. Yes. So we got too much sodium in your blood. Too much sodium in your blood. So that's exactly what that definition means. And that's what, it's an increase in plasma sodium levels. Underline that. Hypernatremia, too much salt. And when that happens, you run into lots of troubles. It causes increased blood pressure, water retention. It does some things that you don't want happening. So you got too much salt in your blood, and a lot of blood pressure people sit there and eat salt, and they give themselves a form of hypernatremia. And that's what's going to happen. It increases your blood pressure, water retention. That's what it does. So hypernatremia we don't want, especially for our diabetic, our high blood pressure people. So what is a diuretic? And they just go right back over it. Diuretic is also called a water pill. It elevates the rate of urine excretion. So just underline it. Water pills elevates the rate of urine excretion. Does a lot of stuff, but come on down. It treats all kind of stuff. It's just trying to get the urine out your body. But what it does, it causes sodium and water loss through urine. It's just another way of saying it excretes urine. So it causes sodium and water loss through urine. Y'all see that in that sentence? Then there's another diuretic called acetazolamide, which just causes your urine to be more alkaline, because we have to keep the pH balance in order to. You don't want too much of that as well. If that is not happening, it'll mess us up. Underline that last sentence there, though. Diuretics can either provoke or prevent certain hormones in the body in order to regulate urine production. It's saying the same thing, it just keeps saying it in different ways. That's all this whole little chapter is. We done said the same things 10 different times, 10 different ways. We're going to reabsorb some of it. We're going to throw out some of it. We got to filter it first. What do we want? What are we going to keep? We got receptors all in the body telling our body what it needs to do. And you need to figure out which one of those hormones are regulating that. Remember that. And that's what our urinary system does. Common medical conditions. Kidney infection. Pyelonephritis. Anything nephrines, pyle is going to be kidney. So that's your kidney and your nephrons are swollen. Put those words together. Pylo, anything pyelogram would be a kidney gram or kidney picture, kidney x-ray. So pyelonephritis is your kidney and your nephrons swollen. Also called kidney infection. Of course, it's a UTI. They're going to still call it a UTI because it is part of your urinary tract system, even though it's your kidneys. When you're hurting in the back, it may be your kidneys that's infected. But they're just going to tell you got a UTI, give you some antibiotics, and send you home. And that's what a kidney infection. Now, when you start having other symptoms, they'll do other things. But most time, the antibiotics go home. But any kind of, if it's not treated, it can cause damage to your kidneys. So don't let things just sit. When you do have an infection, just don't let it sit. You're damaging your kidneys. Also, that is a real easy way to get septic. Anything dealing with your urine and urinary system, our older people all the time get septic real fast. It goes to their brain. When they get a UTI, it's like this. It's almost straight. And that's because kidneys are that important. It's doing all kind of stuff. Symptoms include pain during urination, frequent urination, groin pain. Y'all know the symptoms of urinary infection. You can even put UTI beside that so you won't get confused. Same thing. Same symptoms. It's just they break it down to kidney infection. That means it went on up to your kidneys. But if you put UTI there, if you ever had one, it's saying it hurts. If you ever had a kidney, most of the time, when it reaches higher up, it hurts in that back. You'll be wondering why your back's hurt. You just drink a lot of fluid. Sometimes you can flush it on out yourself. Don't count on that though. If it doesn't reach that far, go get you some antibiotics. Kidney disease. That is a disease, something matter with the nephrons. Y'all know we've been talking about this nephrons this whole while. It does so much stuff. So if that is damaged, they're going to diagnose you with kidney failure, kidney disease, chronic kidney failure, all that. And you might eventually end up on dialysis. But it happens gradually over years, especially people with high blood pressure, because of little bitty things, it's like it's just going to mess up. And the pressure messes up what should be normally happening in those kidneys. Heart disease, kidney disease, and family history. If your mother, father, grandmother has it, you might got a touch of it, or you got it. I know a whole family, their whole family is almost, the mother passed from the same thing, the brother, sister, my friends, she's got it, a touch of it, she's just getting it, but she's 52 or so, but she's just getting it. But it runs in your family, no doubt. It just got her sister a whole lot earlier, but it's just coming to her. Diabetes and high blood pressure cause it. Underline that. Kidney disease, diabetes, and high blood pressure. And they're going to try to manage it as much as possible. When your kidneys are messed up, there's not a greatness that they can do. They try to manage it, try to keep your blood pressure right, your diabetics right, so you give no more damage. Eventually, if you continue to damage, you're going to need dialysis. And that's how it works, because dialysis cleans all the toxins out of your body instead of making your kidneys do it. Glomerular disease, again, glomerulus does a lot of filtering. So if you have damage to your glomerulus, same thing, waste accumulate. But what I want y'all to notice for the symptoms of that, foamy urine, blood in your urine, and you'll have a lower filtration rate. And we'll see that when they pull your blood. When they can't figure out what's going on with you, or you keep holding potassium, especially with tail to tail. Because if your kidney's not working, it messes with potassium. And potassium, that's why you're going to hear that test. When y'all are pulling blood, when y'all are doing things like that, that potassium is a very important level. And if they think it's your kidneys, they're going to think about creatinine levels, glomerular filtration rates. But all of those play a role together. So get that down there together. When kidneys fail or can't work efficiently, dialysis or kidney transplant is needed. Underline that. That's that last sentence under glomerular disease. All I want you to know is glomerulus does a lot of filtering. It doesn't work properly, your kidneys mess up. And all your blood pressures, diabetics, we're worried about them messing up their glomeruluses all in the body. Okay, that foamy urine is a telltale. So always look for that foamy urine. Kidney stones. It's one of the most common diseases of the urinary tract. What happens? Substance is formed from mineral salts and other waste products, and it makes a stone, a hard one that you just can't just urinate out. It sits in there and may get even bigger. I've had one pass in my life, and it felt like somebody was trying to pull my whole body apart. And I don't know what I was eating at the time. I'm glad I don't do that no more. I've never had it again. But it's the worst pain ever. And that's what I want you to underline and star and write out, pain. Now, when you have this test, they're going to tell you all kind of stuff. But when it says extreme pain, what I want y'all to think about? Kidney stone. Kidney stone. Kidney stone's pain. That is where you're going to have the pain. You're going to have blood in your urine. You're going to have burning. You're going to have all that stuff too. But pain is where it's at. When you have a urinary tract infection, it's pain, but it's more of a burning sensation on pain, not so much pain. Kidney stones, that's some kind of pain. You feel like somebody's in there taking a knife and dragging it across your whole abdomen. That's what it feels like. If you ever get one, you tell me about it. But I'm telling you, I mean, it's like I couldn't stand or walk or nothing for about 20 minutes. That's how long it took to pass, but it was passing, which was wonderful. or else they would have had to go in there, or I'd have stayed in pain. But, you talking about somebody went like this and prayed at night slowly. That's what it felt like. But once it was over, I felt like the heaven had came down on me because it's over.
So
No more
you come out
pain,
nowhere?
you're done. Yeah, mine did. And they never really dug too much. I was probably, I don't know, I was a little younger. They just was like, that's kidney stone, and they left me alone. They didn't really go digging at what caused it. But I've never had any more since. If I go back, or if I was to go back and it happened again, then they would dig and try to figure out why, what happened. But it was something probably within that week or so that I ate or whatever it made it. Because that's what happens. It makes a kidney stone. Your body makes it. Not that you want it to make it. That's a bad thing. But that's what happens. And to fix that, we're gonna have lithotripsy, external extracorporeal shock waves. They go in there and either break it down surgically. They go in there, break it down, or now they've got a little laser that they can like shoot it through the skin. They don't even have to make an incision. It's just some kind of, you know, like a, and I think that's the shockwave one that they just put it there and it breaks apart. You're still gonna have to pass them. Hopefully they're little enough so it won't hurt. But they try to break them down so little, because a lot of times you'll have substances in your urine, and if you ever have a lot and you see them, it's probably maybe you might be forming some kidney stones in
Oh,
there.
you can see them come out too?
Kidney stones you can.
What do they look like?
A lot of times they strain them. You've never seen them strain urine. And as a CMA, you might have to do that. They'll put a little strainer in there and tell your patients to urinate through the strainer. It'd be just like a Puritan hat, which is the hat that you put in the toilet, and they'll have a little strainer, and then they'll urinate there, and sometimes you can see them. Yes, and they want to see them. Instead of you hurting and in pain, they want them to come on out. But, yes. You might have to do that as well. Most common symptom is sudden pain, but other symptoms include painful urinating, blood in the urine, fever, chills, nausea, vomiting. But that sudden pain is no joke. It's like something this big is trying to go through your little urethra, and it really hurts. So pain. When you see pain, it's gonna be blood in the urine. It's gonna be all that other stuff. Pain on urinating. We normally think UTI with that. Burning pain, not pain. That's kidney stones. They're two different, and if you ever get them, you know. Urinary retention means you're unable to empty the bladder. You're holding urine. That's urinary retention. Sometimes it can be acute or chronic. Acute meaning something's happened right then that's made you hold your urine or you can't urinate. Something's happening right there. A chronic means that it happens all the time. A lot of times those people will have to self-cap. You wouldn't believe the amount of people that's walking around, self-capping themselves. I knew a lady, and I never knew, but she was always in the bathroom with you. She just sit in the bathroom just like she about to urinate too. And she do. She got to urinate, but she uses a self-cap, a catheter. She just stick it right on up in there and pee like anybody else. But, you know, most of the time they're just carrying in their pocketbook. They're bringing their pocketbook to the bathroom. You know, a lot of ladies do that. You'd never know it. You wouldn't believe there are people out there capping themselves as well. Underline that last sentence under urinary retention. When using catheters, it is important to sterilize them. Sterilization is the process of complete destruction of all living microorganisms. We've already talked about that. But remember, and reiterate, sterilization means complete destruction of all microorganisms. It's very important because you're playing with your urinary tract system that actually goes to your kidneys that does all that work. So we don't want to be playing and introducing bacteria there. And that's why they won't allow CNAs to put in catheters. It's not a hard process, but you've got to keep it sterile so you don't catch infections. And we use autoclaves to do that most of the time. Or most of the time they're just going to have a new sterile catheter every time we put one in. And in the hospital, you're going to have a new one every time. When you're home, they can't afford it like that, so they're trying their best. They're boiling them. They're doing all that extra stuff to keep them clean, to keep away from urinary tract infections. But it can be messed up if you can't urinate. You need to go somewhere. ASAP. Something's wrong, swollen, messed up, infection could be terrible, and it won't let your urine out, and that can mess you up because it's gonna back up into your kidneys, mess up your kidneys. So anytime you notice you have not urinated, your child has not urinated, make sure you get urination. Incontinence, y'all know what incontinence is. Underline that first sentence. Urinary incontinence is the accidental leakage of urine caused by problems with muscles and or nerves that help hold and release urine. Sometimes it's the nerves. They had a stroke. Now the nerves won't tell the body to hold on to the urine, so it just flows on out. And that happens in strokes a lot. Maybe it's a muscle that just is not working correctly, and that happens. But it's a disease, no other. A lot of times they try to underline that last part. Treatments include drugs, special devices to help control incontinence, surgery, or bladder control training. And then come on down to page 107. It is cystitis. Anything cyst for your bladder means bladder. You think cystitis as in cyst, but in your urinary tract system, it means bladder. So it's bladder-itis. What does itis mean? Inflammation, swelling. And it means a bladder infection. So if you got cystitis, bladder infection. And normally they don't even call it that. They'll just say you have a urinary tract infection. And that's what they'll say. It's also commonly caused by bacteria. And that's the same thing as a urinary tract infection. And we will treat it as such. It's the same kind of treatment. It's just bladder infection. You have frequent urges to urinate, a burning sensation, pain, dark or bloody, foul smelling urine, fever, chills. It doesn't have to get that bad. But a lot of times you will feel that burning sensation when you urinate. And I actually had one maybe 2 months ago. And I never had one that bad. But I actually had to go get antibiotics. Normally, you feel a little burning, like I'm going to drink more water. I'm going to get some cranberry juice and drink it. The azo is wonderful. It flushes you on out and you won't get nothing. But that was just the oddest. I urinated, it was feeling great, and I had frequency, but right as it was emptying, I felt like my bladder was, as it was emptying, and it just almost emptied all the way, and it really burned right at the end. And it's a weird, I was like, what is that? And it was just hurting right at the end. And that's why I went and got some medicine. I said, I ain't never been that bad. But I've never had it where it comes all the way up to where my back is aching. But that was weird. As I emptied my bladder, it hurt, which was crazy. Anyway, go get you some antibiotics. That's what we're going to treat it. Underlying antibiotics. Urinary tract infection, that's what it is, but when they specify it, they're going to say cystitis. You must be missing a page. It's okay. It's only 2 diseases on this page. Cystitis and falling bladder. So that's your cystitis and falling bladder, exactly what it means, but we need to know the medical term, cystocele. Underline cystocele. A lot of times that up under there, it exactly means that. That's why rough sex, you need to be careful with that because you're messing up things that hold your bladder in place. If you're really doing that, and I know it can happen, but you're messing up parts and that holds things in place, and it can mess up. Yes, that's what it does. It goes all the way and comes out. I've actually seen a lady like that, and hers was like this. From her rectum, if you know how your body is made down there, it kind of hung a little in her rectum and a little in her vaginal area.
So did she get infections a lot?
She probably, I don't know, but I know she had it for like 10 years until she finally went and got surgery. She went and got it fixed. It's something, she probably did push it up, as her fix, but they actually went and fixed it, surgery-wise. Yeah, she said it was both ways, and she had to wear incontinent pads, and everything's messed up. But it was from years of, 10 years of porno. She was a famous porno lady. And she went back and became a nurse. But she had her videos and all that roughness, ain't no joke. She was like, oh yeah, 10 years of that. And she said, I made some good money, but
But not her still paying that.
not her, yes. Yeah. That's bowel bladder, no other medical name for it, cystocele. Alrighty. We don't want no cystocele, so y'all be gentle. So chapter 10, I'm not really gonna go over chapter 11, but we'll save chapter 11 test. I won't stick them all on there for you. But chapter 11, you just need to go over and remember, because all that is matching places. Like what is urology? It's places you may be able to work. Just look at it, you'll see. Very easy chapter, but it's just a remembering chapter is what it is. You got to remember that. So I would